Approximately a quarter of Zimbabwean women experience sexual violence at some point in their lives. Sadly, many of them have endured the trauma silently, failing to access the care and support they need. That's why the city of Harare has dedicated a wing of its general hospital to deal with sexual abuse victims. It's not the only such facility in the city, but it's the first that's open around the clock.
A lot of violations happen at night, a lot of violations happen during the weekends, during holidays. And the survivors will not have anywhere to go because most of our public facilities will be closed. So we decided to set this up.
That's a game changer for victims for whom time is of the essence, especially the first 72 hours after an attack.
The earlier they come, the better, so that we will prevent transmission of HIV in the cases of rape. So we can give them post-exposure prophylaxis for HIV. We also want them to come early so that we can collect the evidence that rape has happened.
Where HIV tests are positive, victims are put onto antiretroviral therapy. The facility also screens for cervical cancer, treats sexually transmitted infections, and offers counseling. Sister Makuzwa is one of the 10 specially trained nurses that work at the clinic. She gave me some insight into the situations she has to deal with on a day-to-day basis.
What are you telling them in this counseling?
In this counseling, first and foremost, we make them relax. You explain who you are. And then you don't have to blame yourself. Mm-hmm. This can happen to anyone. Mm-hmm. So you don't have to blame yourself. When usually when the survivor comes, at first, they'll be agitated and afraid to say what they want. So we spend a lot of time here. We don't rush. That's why it is a 24-hour clinic, so that we don't rush.
Cases of sexual abuse against children are on the increase, and the clinic is also geared to meet their unique yet disturbing circumstances.
These are the toys that they'll play with, and these are the ones that they'll illustrate what would have happened to them. For example, like this is a girl. If it is a girl child, she'll explain what would have happened to her. Anyone has touched a breast or a private parts. So she'll illustrate using the doll.
The other special groups treated here are abused men and commercial sex workers. Many cases of sexual and gender-based violence go unreported for various reasons, such as stigmatization, lack of awareness, but also crucially accessibility. And that's why Harare City Fathers hope that this center, located close to Harare CBD, can increase the number of cases that are reported, but also be the beginning of many more that will provide a safe haven to victims of this vice. Farai Mwakutuya, CCTV, Harare, Zimbabwe.